Welcome to AI Rounds, your weekly dose of AI in medicine and education.
We are your hosts, Dr. Nuria
and Dr. Morgan Leaf. Each week, we'll bring you a quick dive into the latest in artificial intelligence and how it's transforming healthcare, medical education, and medical communications.
From the tools changing how we teach, learn, and write, to breakthroughs shaping patient care. If it's new, exciting, or just plain useful, we're talking about it.
In just 10 to 15 minutes, we'll get you up to speed and maybe even spark your next big idea.
Let's make the rounds.
Hi, Nuria.
Hi, Morgan. How are you?
I'm great. How are you?
I am doing fine.
Well, good. Well, I'm interested to talk about our topic today is some data that was published by HIMSS, and they put out a report called The State of Healthcare AI and Digital Transformation, Adoption, Risk, and Readiness. And they're looking at 12 data points revealing how healthcare is scaling AI in the US and where critical gaps remain. And this was really interesting to me because I spend a lot of time in one of my roles speaking with physicians, and we recently started asking them how they use AI in their practice. And I think what I'm seeing here reflects what I'm hearing from them. And it's certainly I don't know, I think some of the numbers are kind of astounding as far as adoption when you consider how new AI is. So do you want to take us through some of the statistics?
Yeah. So HIMSS is a society for health informatics, and they are the people who are, doing informatics in healthcare, basically. And obviously AI is being integrated into almost everything to do with informatics. So I went to the HIMSS, to the big conference, a global conference in Vegas a few months ago, and I discovered that AI in healthcare, there is huge adoption of AI in healthcare. And this kind of shows that, they found that 71% of healthcare organizations have adopted AI in some capacity. 71% is really amazing. And I don't know, have you experienced this, going to the doctor and them they're called ambient scribes or
Note
ambient
takers. Yeah, I
documentation?
haven't. I know a ton of people use them. My personal doctor, I have a direct primary care, and so she just owns her own office. So I think you see those technologies a little bit more in healthcare organizations. So I haven't seen them yet, but I know that they are out there.
Yeah, it is almost everyone that has adopted it loves it. There are very few people that don't like it. It's so people don't like the word scribe too much, so it's called ambient documentation. And also ambient documentation is bigger than just the scribe, than just the
Yeah.
transcription. But basically it means that physicians, clinicians don't need to be on their computer on the electronic record, filling it out. They can be talking because this ambient documentation is one, recording, two, creating a transcript, and three, filling out the EHR for
Right.
the clinician to then review and approve. And then I think a lot of them are super HIPAA compliant. So after the
Oh, yes.
visitation, it deletes the recording, and the transcript is not that is there
Mhm.
forever. So it just what's in the EHR is what
Right.
stays. And I know that vets are using it. I know that
Interesting.
ophthalmologists, everyone is using it.
Yeah. Well, the other feature that they have, by the way,
Yeah.
besides writing the notes, is if they hear you say, I'll order you some prednisone for that, or I'm going to order a chest x-ray, it actually puts in the orders for you
Okay.
to sign, which is huge.
Which is huge. Yeah.
Huge.
Yeah.
I was very guilty when I was in practice of I don't know, if somebody asked me for something small. Oh, can I have a prescription for Tylenol? It just didn't stick in my mind and I would forget. So that's huge. And we know that note taking for most patient visits, it takes twice as long to write a note as it actually takes to perform the visit. So there's a huge burden on time. I was oh my gosh, the hours and hours and hours of my life I lost to writing notes when I was in practice, I
Yeah.
can't even count. Like, this would have been such a huge thing for me. I had a hard time making myself sit down and write notes. So this is huge, huge.
Yeah, and I mean, the fact that everyone is incorporating it shows how good it
Yeah,
is. So, like, of those 71%, like, 48, so nearly half, integrated AI into care delivery and operations. So, this is what we're talking about, but also clinical workflows, decision support, and operational systems. So, like, some of the things that I've heard at HIMSS are like, for example, some have incorporated into hospital systems that when something triggers the system that they're going to have income like a rush of patients into the ER. The system goes through all of the patients that are admitted and finds patients that it would be safe to discharge to send home
passing
and
out on the street, no. Uh,
and like helps like clear up beds and things like that. And I
interesting.
mean the most known way is with diagnostics, right? With imaging, that AI
Right.
goes through scans and has been helping radiologists for a few years now. So it is, yeah, it's being integrated in quite a few aspects of healthcare.
Yeah. Radiology and pathology are definitely the ones who led the charge with AI technologies, which makes sense because
Yeah.
what they're doing is digital. Yeah.
Yeah. So then 3 and 4 plan to use AI to advance patient-centered care, which is really interesting. So they want to use it for identifying care gaps or disparities, for chronic disease management, for personalized care plans, and for patient-reported outcomes and feedback. And this is also very interesting. And like, I know I worked with a device company this year, medical device company that was an expert system. So not generative AI, but a type of artificial intelligence called an expert system, so rules-based system to help patients with heart failure and
Mm.
it helped titrate the medications, which is like
Oh.
not easy to do, and it decreased the number of readmissions to hospital by a lot. It increased the number of patients per nurse by like from one nurse to 30 patients to one nurse to 300 patients. The results, like lots of clinical trials run on this, and like the results are amazing. All because it has like this rule-based system. So it's not just gathering the data, it then analyzes the data and only alerts the clinicians if there's a need to alert. But it means that it's monitoring daily data, which wasn't possible before just because of time. So like I
Yeah.
was like really impressed with that device. And I'm like, I think like things like that are awesome for people with chronic disease.
And I think, it's important to point out as we have this discussion, right? Because probably our audience is more educated on this than the
Hmm.
general population. But just to be sure, these tools that people are using in hospitals are highly likely to be, I'm not going to say exclusively, but are closed systems, right? Are tools that are designed exactly like you said. This tool was trained on data for heart failure. Because I think a lot of times people get nervous when they hear AI in the hospital and they think, my doctor's using ChatGPT to diagnose me. No, that's definitely not it. And I know, like we mentioned about the note taker, right? One of my friends here in Santa Barbara said, oh my God, I went to the OBGYN yesterday and she asked if she could have this recording on and it would make the notes. And I said, no. And I said, oh my gosh, why did you say no? You just made her life so much harder. Well, I don't want to have, and I was like, but it doesn't store your information. Like you're not in any danger. Oh my gosh. And so people bring these understandably preconceived notions
Hmm.
and when they're thinking about these things, but it's really important to know the difference between an AI system that was trained only on a million pathology slides or
Hmm.
only on a million chest x-rays or only on data from patients with heart failure versus chat going to chat gpt,
Yeah.
right?
Yeah. No, this is not ChatGPT. This is a completely like these are different systems.
Yeah.
Yeah, that are all HIPAA compliant and all of that. I know that, for example, a lot of systems, again, hospital systems, and not only even clinics, like outpatient only, they are using integrating a lot of chatbots for patient calls. So if you call to book an appointment or something like that, and even those chatbots are not ChatGPT. Okay, like those
Yeah.
actual chatbots, they will talk to you. But apparently, so it used to be that if you got a stupid robot on the phone, you wanted to kill the robot. But now these robots are really good, and they like will help you like do whatever it is that you need to do. They know when to escalate to a human, and this is the great part, is that when you actually need to talk to a human, wait times are now all below 5 minutes,
Mm.
because humans are only talking about, they're no longer like booking your next appointment, which is unnecessary.
I'll believe it when I see it. I am like pre-annoyed with the concept of doing that.
Yes. But that was like one of the things that like some clinics were like, oh, it has improved our operations by so much percent and all that. Yeah. Your face.
I am skeptical.
Yeah. All right. So, but now on the other side of this, on the flip side of this, similar to what we see at the Alliance, so in the community of people who do continuing medical education, as what we see at AMWA, the adoption is outpacing preparedness. So, like, only 51% of leaders say that their organizations have the resources to manage AI related legal and regulatory requirements. Only 47 are confident that their data is accurate, and only 21% say that their data is fully leveraged for clinical and operational decision making. So, and the data part of this is really key, and it's really important because of something that we said in a previous episode, right? One thing that the machines are really good at is going through data. But for the machines to go through data, we need to have the data organized in a way that the machine can go through it and make decisions. And this is something that almost everyone, including me, my data is not ready. We are all going to like, it's going to be an effort to make all of our files data ready for AI ready. Yeah.
Yeah. Yeah. I mean, these first two statistics are alarming to me.
Yes.
And I wish they gave a little more information in the summary because I want to know, like, who did they ask these questions to? Was it large care organizations? Was it smaller practices? Because if you're thinking like healthcare organizations, for only 51% of leaders to say their organization has the resources to manage legal and regulatory requirements, that's really alarming to me. Like, you should have a legal staff that can handle everything related to this. Like, this is part and parcel with HIPAA compliance and stuff. So
Mm-hmm.
I do not know what that's about. And only the 47% feeling confident that their data is accurate is really interesting to me because if you are asking healthcare leadership this,
Mm-hmm.
I wouldn't actually expect them to know the answer, right? Because that's not their specialty. Why would a healthcare administrator know if pathology data is accurate, right?
I mean, unless it is the what are they called? The chief informatics officer,
Yeah, they might know.
maybe. Yeah.
Maybe.
Yeah. So maybe maybe, I don't know. I don't know.
Yeah,
Yeah, I would love to see methods. I agree with you.
right.
Yeah. And I'm hoping that the actual report is coming out, and not just the
Yeah.
summary. Mm-hmm.
Yeah. Yeah. Is that confidence actually that the data is not good, or is it that we're just not asking the people who know the answer to that question? I don't know.
Yeah. Because like where data is really important is when AI is making predictions that will lead to decision making, right? So
Mhm.
for example, like the example I gave of we expect a surge
Right.
of people that will need to be admitted. So you need to know that the data the system is processing to suggest people to discharge is good data. Otherwise, it
Yeah.
might end up discharging people whom you shouldn't discharge. Like these are key. Yeah.
Well, hopefully, I mean, that almost certainly has a number of humans
Yes.
that would evaluate that, right? It's not writing the discharge order. And I am skeptical of that system. I mean, a little bit, just because in my experience, and I'm a pediatrician, but readiness for discharge often has more to do with social factors than medical factors. You're not going to discharge somebody who has a whole family at home and their wife is a doctor at
Mm-hmm.
the same time you're going to discharge somebody who is unhoused, right? So there's a lot of social factors that go into that decision, but you know, maybe it can be a helpful tool.
Mm-hmm.
I think what's ingrained in me as a physician is any tools like this that promise to save money, right? Because
Mm-hmm.
that's ultimately what they want to do, get more patients in the door, make more money, whatever it is the drive of healthcare administrators.
Mm-hmm.
And so we get nervous about that as clinicians. But that being said, that's why I say we need to know a little bit more about, like, why isn't your data good?
Yes. Why do you think your data is not good?
Half
Yeah.
of you say your data is not good. That's weird. Why are you doing this? Why are you so eager to adopt these tools
Mm-hmm.
if you don't think they're good, right? That's really interesting.
I don't know that that they think that the tools are not good, but that they don't think they are ready. They don't think they are data ready. So maybe they are adopting the ambient documentation. So that
Right.
would be also something to see, because I know that everyone is adopting the lower risk ones, right? The ambient documentation. Anyone that can afford it is adopting it. The call centers, the call help, again, like that's low risk. Almost
Totally.
anyone that can afford it is adopting it. The
Yep.
other parts of it are much more pilot based still.
Yeah. Yeah, for sure. For
And
sure.
that is where the data matters more and more than the first two, right?
Yep. Absolutely. Yeah, that's an important point. Yeah.
All right. So I think we covered pretty much what the little summary says.
Mhm.
Because these are informatics people, they're very, very concerned about cyber attacks. And they are concerned about something called interoperability, which is for hospital people to think about and not us as medical, right? Maybe we should have a concept of it, but basically all the systems need to talk to each other so
Yeah.
that one hospital system can work as one. Let's put it like that. I think that's as much of an understanding of it as we need to have.
If anyone wants to geek out about interoperability, I am board certified in clinical informatics. You can DM me and we can talk all about it.
I think that this is fascinating, but it is not what I work on. So,
Right. And sometimes we get really interested in things because we experience them as patients, right? I
yes,
know I
true.
do, where like you turn off your writer brain because you're like, I don't know if I'll be writing about these things, but I will be experiencing them, or I am experiencing them. And by the way, all this survey is talking about is hospital specific implementation of systems.
Yeah.
There's still a lot of people in these organizations using open evidence. I can tell you the vast majority of
Oh, yeah.
physicians use open evidence in their day-to-day work right now, right? And that doesn't involve their hospital. They're just doing that on their own. I mean, maybe it does. Some people might have a link in their
Mm-hmm.
EMR to open evidence, but a lot of people are probably just using that on their own. So even if a hospital system hasn't implemented AI tools,
Mm-hmm.
clinicians might still be using them on their own. And that's important to know too.
Yeah, open evidence, I think open evidence is Mayo Clinic.
Yeah.
They were first out the door. It's a search engine so it's an AI search engine that like goes through medical literature and gives you answers based on that and links to the papers and all that. And it's specifically designed for clinicians. You need a clinician
An
number.
NPI number. Yeah.
There you go, to be able to access it. And it's huge. Yeah, everyone.
And it has an ambient note taker.
Oh, it does? Oh, I
Hmm.
didn't know about that. Okay.
Yeah. Yeah. They add new features a lot. It has an ambient note taker, and it actually has a really interesting feature now too. I have an account where you can make files in there for your different patients. So maybe you have like a complex patient that you often need to go look
Mhm.
things up about. You can put it in, you could put the patients, I assume it's HIPAA compliant. I don't have patients anymore, so I haven't
Yeah.
tested it out. You put the patient's, name and everything in there, and you can keep a file with all the things you've looked up about, their condition or whatever it is that you need. It's cool.
Yeah.
Mhm. Yeah,
Yeah, and those are solutions that are not just for big hospitals, that are like for that
exactly.
have private practices and like smaller practices as well, which is good because a lot of people only go to smaller practices. Even though everything seems to be going into big healthcare systems, there are still lots of small practices and private
Yeah,
practices in the US.
it's true, especially here in California because our laws are different. Yeah. Yeah. Yep.
All right. I thought this was really interesting. I'm always interested in, I think if there is one way, like the entry point of AI into healthcare will be via health informatics. So that's why I got super interested in health informatics, joined the society, went to the conference, and here I am.
I've never been to the HIMSS conference, so you're a step ahead of me.
It is the biggest conference I've ever been
Well,
to.
now that you showed me there are puppies there, I definitely wanna go
And
next year.
kittens.
Oh my
Both.
god. I
Puppies
mean,
and
come on.
kittens. It's in Chicago next year.
But wait, though. Wasn't HIMSS the one that had Dr. Oz as a speaker?
They did, yes. And not
Mm.
only Dr. Oz. Your face. As like they are doctors are conservative people, Morgan. Don't you know this?
Not pediatricians.
Not pediatricians, but
We actually rank as the least conservative,
oh wow. Okay.
the most liberal
Yeah.
specialty.
Yeah.
But, yeah, that makes them off my list. There's no amount of puppies that can make up for Dr. Oz,
But
but
maybe he's not there next year. I don't think he's gonna be there next year.
maybe more conferences can just think about having puppies. I think that's the solution.
I
Yeah.
totally agree. Puppies and kittens.
Well, I think I say this all the time, but this is another topic I'd love to revisit in a year if they put
Mm-hmm.
this out again and see. Is it like 100% of people next year instead of 71% have
Yeah.
adopted? I don't know.
Yeah.
We'll see.
We'll see. All right. Thank you so much.
Thank you, Naria. See you soon.
Bye.